Rod Witkos, paramedic. Whenever you're dealing with somebody who's having a heroin overdose, how do you know it's a heroin overdose?
Typically, a heroin overdose presents in sort of a classic fashion as a depressed mental status. They have a decreased respiratory rate. Typically, they're diaphoretic, which is sweaty.
Okay.
They have constricted pupils.
Okay.
Usually, there's paraphernalia from the drug activity at the scene, dirty needle or a heroin wrapper, something to lead you to believe that they've used. There's also indications of track marks on their arms.
Mm-hmm.
Once we identify that, we'll begin our course of treatment. Typically, the fire department will get there before us, so they've already begun their assessment and they've actually started breathing for the patient. So they'll typically let us know while we're still on the way that it appears to be a heroin overdose.
Okay. And what kind of stuff? What is the course of treatment for that? What do you guys do?
Well, the most important thing is getting the oxygen back into them because the narcotic suppresses the respiratory system. So getting them to breathe on their own. The lay person would do mouth to mouth. We use bag valve masks to breathe for them.
Okay.
And then we'll establish an IV and we'll give them intravenous Narcan, or we'll use what they call a mucosal atomizer device, which is an attachment that goes on the end of a syringe, and we'll inject the medicine up into their nair of their nose.
Okay. And wait, and this stuff is called Narcan?
Narcan. It's naloxone.
Okay.
Is the brand, is the trade name, and then.
And we're hearing, if you hear noise around here, because we're in this ambulance parking lot. Anyway, so you give them the Narcan, and
After, what happens is the Narcan binds with the narcotic receptors, and the effects will be reversed. So after a minute or two, you'll see the patient's pupils dilate, and then a lot of the time they'll just sit upright, saying, "What happened?"
it just takes it out.
It takes the overdose completely away. It completely reverses the narcotic effects.
Well, I've heard that it can wear off sometimes.
It does wear off. Typically, the half-life of the Narcan that we give is shorter than the half-life of the narcotic or the heroin that they've injected.
Yeah.
So it's important that they get evaluated in the emergency room because the Narcan can wear off and the heroin will still be in their system, and then they'll stop breathing again.
So whenever you give them the Narcan, is it then, and if they're breathing okay, then you can just kind of like walk them over to the ambulance, or?
We try not to walk them. We don't want them to exert themselves any more than they've already gone through a hypoxic event. So it's important to kind of treat them gently.
Yeah.
I mean, they can get upset stomachs a lot. They frequently vomit when we give them Narcan. It's a known side effect of the medication.
Mm-hmm.
So, but once they're awake and alert, and they can talk to you and provide all the history of the event.
Good deal. Brendan.
Growing up in the city, I think we always, in the 80s and 90s, we always joked that Worcester was like the heroin capital of the world. And I'm not sure if that was actually based on science or just our own depressed notion of the city we grew up in. But what are you folks seeing today for opiate usage throughout the city? Is it higher than it was in the past, or is it?
I think there's a different route of abuse. I think with the AIDS scare that came along, a lot more people will snort the narcotic rather than inject it because they want to be more careful with the use of needles. But like you said, this has always been we called it heroin chic town because the heroin was the drug of choice for people of Worcester for some reason. And it was known, the hepatitis C outbreak that began back in the late 80s, early 90s, it kind of was noticed first in Worcester because of the high percentage of IV drug abusers.
And are you seeing upticks as well or with prescription opiates, or is that kind of...
Well, a lot of people are using, they're taking medication like Percocet, and they'll crush it up and snort it, and that'll have the same effect as injecting heroin.
And how about demographics? Is much changing in terms of demographics?
It's been a very wide demographic. We haven't really identified a sort of specific person. We see males, females. We see them anywhere from 18 to 60. It's been varied over the years.
But overall, do you think the numbers are pretty much the same as they always were?
I think it's pretty much. I think it's pretty much stabilized. I think, in fact, if anything, the population that's using is getting a little older.
Okay.